As people grow older, subtle but powerful shifts in how the body processes energy begin to emerge, often without warning. One of the most critical of these shifts is the gradual development of insulin resistance, a metabolic condition where the body's cells become less responsive to insulin, the hormone that regulates blood sugar. While this process can begin quietly in middle age, its impact on weight gain, particularly abdominal fat accumulation, can be both profound and deeply frustrating. Even individuals who eat moderately or maintain a consistent diet may find themselves gaining fat, especially in the midsection, and feeling more sluggish, bloated, or fatigued. This isn't simply a matter of eating too much or exercising too little. It is a biological response to aging that rewires how the body handles glucose, fat, and energy, and it carries serious consequences if left unaddressed. Insulin is essential for life. It allows cells to absorb glucose from the bloodstream and use it for energy or store it for later use. In a healthy system, this process is tightly regulated. But over time, especially with age, cells in the muscle, fat, and liver tissues begin to respond less effectively to insulin signals. As a result, the pancreas has to produce more and more insulin to achieve the same effect. This condition, called insulin resistance, leads to chronically elevated insulin levels, even when blood sugar appears normal in early stages. That excess insulin, however, has powerful effects on fat storage. It signals the body to shift into storage mode, to build fat, especially in the abdominal region, and to make it harder to release stored fat for energy. For older adults, this becomes a metabolic trap. With age, muscle mass tends to decline, a process called sarcopenia, which further reduces the body's ability to utilize glucose efficiently. Less muscle means less glucose disposal, and more excess glucose is diverted into fat storage. At the same time, physical activity often decreases and recovery from exertion slows, making regular exercise harder to maintain. The combination of less muscle, less movement, and a more sluggish insulin response creates a perfect storm for weight gain, especially around the belly, which is where fat cells are most hormonally active and metabolically damaging. Abdominal, or visceral, fat is not just an aesthetic issue. It wraps around internal organs and floods the body with inflammatory signals, further worsening insulin resistance and driving a cascade of metabolic problems. This includes increased risk for type 2 diabetes, fatty liver disease, heart disease, and even cognitive decline. Many people mistakenly assume these conditions are simply a part of getting older, when in reality they are often fueled by preventable metabolic dysfunction, starting with insulin resistance. Here's the serious warning. Insulin resistance often goes undiagnosed for years. Blood sugar levels may stay within the normal range while insulin levels quietly rise in the background. By the time glucose levels begin to spike, significant damage may have already occurred. The signs: unexplained weight gain, difficulty losing fat despite dieting, sugar cravings, energy crashes, or increased waist circumference, are often brushed off as normal aging symptoms. But these are red flags, and they should not be ignored. The good news is that insulin resistance is highly modifiable, even in older age. The body remains responsive to key interventions that can restore metabolic flexibility and improve insulin sensitivity. The most powerful of these interventions is physical activity. Resistance training, in particular, is critical. It builds and preserves muscle mass, which acts as a glucose sink, drawing sugar out of the bloodstream and reducing the body's need for insulin. Even a modest increase in strength training, 2 to 3 sessions per week, can dramatically improve how the body processes sugar and reduces fat storage. Cardiovascular exercise like walking, cycling, or swimming also improves insulin sensitivity and helps reduce visceral fat. Importantly, these don't need to be intense or exhaustive. Consistency matters more than intensity. Moving the body regularly, even light movement like walking after meals, helps the muscles clear glucose more efficiently and blunts the insulin spike that typically follows eating. Nutrition also plays a central role. Diets high in refined carbohydrates, sugars, and ultra-processed foods are notorious for worsening insulin resistance. Replacing these with whole, fiber-rich foods, vegetables, legumes, nuts, seeds, lean proteins, and healthy fats can reduce insulin demand and calm the inflammatory state that drives fat accumulation. Low glycemic eating, where blood sugar is kept stable by avoiding sharp spikes, has been shown to support long-term weight loss and metabolic repair in insulin-resistant individuals. Fasting protocols, such as time-restricted eating, may also help. By giving the body longer breaks between meals, insulin levels can drop, allowing the body to access stored fat for energy more efficiently. However, these strategies must be used carefully in older adults, especially those with other health conditions or medications, and should ideally be discussed with a healthcare provider. Sleep and stress management are often overlooked but essential. Poor sleep disrupts insulin regulation and increases hunger hormones, while chronic stress raises cortisol, a hormone that drives insulin resistance and abdominal fat storage. Simple steps like establishing a regular sleep schedule, practicing relaxation techniques, or reducing caffeine and screen exposure before bed can support hormonal balance and improve metabolic health. In summary, insulin resistance is a key driver of age-related weight gain and abdominal fat accumulation, and one of the earliest warning signs of metabolic decline in older adults. It is not just a problem of sugar metabolism, it is a fundamental shift in how the body stores energy and handles nutrients. Left unchecked, it accelerates disease and diminishes quality of life. But when recognized and addressed early, it can be slowed, and in many cases reversed, through targeted lifestyle changes. Aging may tilt the metabolic balance toward fat gain and energy loss, but with informed effort, older adults can restore much of their vitality, strength, and metabolic resilience. The key is not to wait until diabetes or disease arrives. It's to act when the earliest signs of insulin resistance begin to appear.